As the third wave of the pandemic moves across the country, there is one major concern. COVID-19 will start to hit younger people harder. This is something Dr. Susan Shaw is starting to notice in Saskatoon. She's an ICU doctor and Chief Medical Health Officer of the SHA. She joins me now. Hi, Dr. Shaw.
Good evening.
Tell me about your last stint in the ICU. What did you see?
Well, I worked the last week in one of Saskatoon's intensive care units. And in addition to seeing more patients than we usually look after in normal times, I saw people with COVID who are sicker and younger than we've seen previously in earlier parts of our pandemic.
Now, age was something that seemed previously to work in favor of young people. How have you seen that shift in the last little while?
Well, I think we've seen that, and we're not sure completely if it's whether it's the increasing role of the variants in COVID in Saskatchewan, or whether it's that the behaviors and the types of actions of people out in the community, particularly in the groups that we're starting to see, are contributing. But we are seeing younger people. We also know that our vaccines are working. So that's the good news, as we've rolled out vaccinations primarily into our people most at risk of serious illness or death, which is our elderly and our vulnerable people, that those people are being protected. So that's the good news here. The challenge is, as the variants show themselves and community spread continues, we do see younger people, not just in Saskatoon, but particularly across the southern part of our province, now being struck with COVID, and they're presenting with very serious illness and presenting either with more rapid illness, or they're presenting later in their illness and requiring admission to the hospital and even intensive care.
I understand a lot of patients are showing up to the hospital very sick, only to realize then that they actually have COVID. How does that plan of attack change for doctors in that case?
Well, it means that we're missing an opportunity. If we don't know you have COVID and you don't know you have COVID, we're all missing an opportunity to intervene. We do know that the treatment of COVID is primarily symptomatic and supportive. So it's looking after people, making sure they're taking care of themselves, that staying hydrated, that they're seeking care and follow-up. But we do know that there is a window before you have severe illness, that there is a role for other therapies such as steroids, which can save lives. And if you present late, then you've missed that opportunity because you're already in that severe illness. You'll still get the therapy, but the full benefit of it probably is missed. The other missed opportunity is that if you're sick and you don't know it, you're not able to protect others from being infected by the virus. And so that really worries me. If people have illness but are not able to, or don't know that they need to self-isolate, then other people are at risk, particularly in people's homes and in people's workplaces.
I want to go back to what you said about the severity if you can't treat it in time or early enough. How have you seen that manifest in young people?
Well, we're seeing people present to hospital, learn that they have COVID or have it confirmed that they have COVID through their first test, and be admitted directly into the intensive care unit. That's new. I would say earlier in the pandemic, particularly with the original variant, we usually had a window of about 8 to 10 days before someone became, if they were going to become sick enough, that they became sick enough to need hospital care. And then even after that, while in hospital, while getting supportive treatments, if they were going to get sick enough to need intensive care, there was that time window. We're not seeing that right now. I would say that the more common presentation seems to be presenting to hospital and going straight to a high level of supportive or even intensive care.
In Regina specifically, we've seen the variants of concern play a bigger role in our numbers in the south. How concerned are you about that for Regina, but also for spread through the province?
Well, I'm concerned for the whole province. The variants have shown up perhaps first or most quickly. They've spread in Regina, but this is not a Regina problem. This is a Saskatchewan problem. And we already are seeing variants in other parts, particularly in rural and the southern parts of the province. But we are starting to see an uptick in the number of COVID cases that are variants in Saskatoon and into the north. This means we all need to think about adopting the public health measures that were originally set out in the Regina area. And I encourage everybody to stay home, keep your bubbles small, and do everything you can to prevent transmission. Because we do predict that without that, the variants will take over everywhere. And if they're more infectious and they cause more serious disease, this will cause a lot of harm and stress, not just on the healthcare system, but on people's families.
I know you've mentioned young people and people in general coming straight into hospital, into ICU. That is a lot for you and your team. What's going to get you through these next few weeks?
I predict it's going to be continue to be very hard, particularly for my colleagues and myself working in the intensive care unit, in the emergency rooms, on the ambulance teams. What's going to get me through is I do have a lot of hope. We do know the vaccines work. And we are so far, and we will continue to be able to vaccinate people as quickly as we get vaccines into the province. We have three very safe options, and I just recommend to everybody that when you get your invite and your offer, you accept it. And that gives me a lot of hope because we are seeing that the vaccines are effective, particularly at preventing severe illness and death.
Dr. Shaw, thanks so much for your time and for your work.